Alrighty, here we go. This is going to be all about enteral feeding, enteral medications, really. When it comes to having, this is our patient, and when it comes to having a PEG tube and you doing medications or feedings, there's two ports here. They call this a medication port here, where you can insert liquid medications without stopping a feeding if they are compatible. But a lot of times, if this is closed, and depending on what's going on with the patient, if this is closed and you come in to do an enteral feeding or medications or whatever, and you're trying to pull this off and this won't come, you may have to release pressure on the side with the medication port to be able to open the top like that, okay? So that's something that I found during clinicals that was happening to some of the students. So there you go, a clue. The other thing is these pieces right here, this tube right here that goes into the client, you saw how they put them in. This tube, we don't want to have to replace. So you as the nursing student, we don't want to clog these. And medications will definitely clog them if you don't crush them well enough, if you don't put enough water in previous and after. So you want to put it in previous to kind of lubricate the tube, and then with, and then after. So you need it clear flowing so that tube you can see is completely empty. So what we're going to do, also one of the big deals is compatibility of medications. I have a list of medications, number one, that can't be crushed, because you can't crush all medications. You can't crush potassium. You can, however, put a little bit of water on it and it will immediately melt down and you can give it that way, but you cannot crush potassium. And medications sometimes can't go together. So you wouldn't give your thyroid with everything else. So that when you give medications, you need to know what those medications are, if they're compatible and if they're crushable. We do have a list. Norma researched it and brought it out. I'll try to get it onto Excel today and get it out to you. But that's what's important about medications. Anytime you give medications, are they compatible? If you don't know and you don't know how to get all of them done because you don't have time, call the pharmacy. Say, this is my list of meds that I'm crushing. Is this okay? Are these all compatible and can I crush them all? So whenever you have a question, go ahead and call pharmacy. They don't mind. Absolutely not. And usually the pharmacy is pay less for facilities. But okay, here we go. Also has a clamp. That clamp should always be clamped unless you're ready to go. Because clients, especially some clients, they like to help you have the full experience when it comes to PEG tubes. So if you open that up and you open a clamp, you may be getting a face full of stomach content. So if the client coughs or sneezes and that pressure is put into the abdomen and on the stomach, then it will regurgitate for you, just for you. So let's move forward with this. And I'm gonna have to pause and go grab. Okay, so I have my gloves, and you do want to wear gloves when you do enteral feedings. Number one, so you don't get the medications on your hand. We have this special little ancient crusher, and that's what we're going to be using. That is not what is normally used. Usually people have what's called a slammer, where you're slamming it down. Somebody stole my stool. All right, so we're going to make sure we hand hygiene. We put our gloves on. We have these very special medications here for Betty Boo. And remember, when you're popping a medication pack, to always start at the number 30 and not to, like blueberry picking, go all over the place, because that one looks better. Always start at 30 and move down until you know it's time to reorder, okay? So we always put our cup underneath, like that, and we push so that it ends up in the cup. We never hold medications in our hand. That's a big no-no. Do we pick them up off the floor? Yeah, we don't do that either. And if we happen to trip and spill the cup, we have to still put those in a sharps container, dispose of them with the nurse, and then we'll start over. And of course, I started at 24 instead of 30. So yay, I started at the bottom. Okay, then we're gonna push. We're gonna put our medication so that we can crush it. We'll screw that down. That's not crushing at all. Super cool. No, we thought Smarties would work better. I'm finding that not to be the case. Now it's gonna work. You don't need to go to the end for outtakes. They're right here in the middle. We're getting there. You use scissors to crush? No, but I do. Don't do this at home, peeps. This is why they use slammers. Because this is ridiculous. The red one's the good one, but I didn't get the red one. All right. But I'm gonna get a slammer here in a second. I don't have time for this. So I'm gonna show you the powder. Okay, so this is the powder, and that's how fine it needs to be. It needs to be powder so it can't clog the tube, right? And then you're gonna mix that with water. And you're gonna kind of make a slurry of it until it's nice and smooth. It doesn't have a lot of chunks, because what will chunks do? They will clog the tube, right? And then you'll put water in a container like this. This really isn't going to cooperate for me, so there we go. Should have thought this through. Now, you have your tube, right? And you're going to insert your tube, but you're also going to hold the tube and this with the same hand so that they cannot come apart. Because if they do come apart, you've got medications in your shoe. So make sure that you learn how to grip them both together so that they can't come apart. Also, know that when you put anything in here, you want to make sure that your hands can be on top again so you don't get a face full of something. And so what we're going to do is we're going to lubricate. We're ready to undo. We're going to lubricate our tube with some water. We're going to pour our medications in, and then we're going to rinse that all the way through until it's clear. And that will flow by gravity. We never push with a plunger. Pushing with a plunger is not cool. Did you see how I let go a little bit and it leaked? This is going marvelously, don't you think? I think it is. All right. So we've got all that through. We're going to put it, and we all, because why would we put more water in if it's not necessary? Because people with PEG tubes are always dehydrated. They're always dehydrated. And you can see that just flows via gravity. And I'm not sure why it's leaking, but it is. And then when it's all clear and we see that there's no medication in the tube, and we clamp it before we take this out and then pop it in. Simple, easy? It absolutely is. It's also easy to make a mistake with medications and put medications together that shouldn't be if you don't do your due diligence when giving medications. Okay, that's it. That's pretty easy, huh? Enteral feedings are done the same way. Remember that 120 ml problem, that 1/4 strength thing that we did? This is where you would pour it. You pour your can in, then you pour water in, and another water in, and you mix it up, and then you would pour it into here little bit by little bit while your tube runs it down with gravity. Again, we never push. But do we sometimes, let's see, do we sometimes pull fluid from the stomach before we feed a patient that has a PICTU? We do. We'll put the plunger all the way down, put this in the tube, we'll pull back, and if we get a lot of residual, we usually skip that next feeding or at least delay it until that residual is gone. Do we throw that away that we pulled out? No, we put it back because that's their stomach acids. That's their balance, and we don't want to take away their balance. We put that back in. I know some facilities do pull it and throw it away, but in reality, those are the gastric juices that need to be in the stomach. Okay? All right. Any questions? Email me. We can talk because we have like meetings, so we could talk in those. Okay? All right. There we go. Thank you.